This video will contain a basic overview of the Autonomic Nervous System, abbreviated ANS, along with a step-by-step diagram outlining the visceral efferent nerve pathways within this system. In another video, I went over somatic nerve fiber pathways that supply the voluntary skeletal muscle and body wall sensations. For this video, you will need a paper and a few different colored pens or pencils if you desire. I will continue to use Pilot gel pens and Sharpie highlighters for clarity. When drawing out nerve pathways, we are most concerned with the location of each neuron cell body and where the axon projections travel to reach their target tissue, and sometimes what neurotransmitter is released at the synapse. The two main neurotransmitters used by the autonomic nervous system are acetylcholine, released by cholinergic neurons, and norepinephrine, released by adrenergic neurons. You should know that in neuroanatomy, a nucleus is a collection of neuron cell bodies in the central nervous system, and a ganglion is a collection of neuron cell bodies in the peripheral nervous system. We can describe neurons by using words like efferent, afferent, somatic, and visceral. Efferent describes neurons that travel from the central nervous system to the peripheral nervous system, carrying motor innervation. Afferent describes neurons that travel from the peripheral nervous system to the central nervous system, carrying sensory information. Somatic refers to voluntary structures of the body wall, like skeletal muscle. Visceral relates to involuntary organs and glands. These structures are supplied by neurons in the autonomic nervous system. Like in the somatic pathways, there are two main nerve fiber types. General visceral efferent, abbreviated GVE. These provide involuntary motor innervation to glands as well as smooth and cardiac muscle. And general visceral afferent, abbreviated GVA, carries sensory information from various organ systems. These neurons travel toward the central nervous system along existing nerve pathways and are organ-specific. They won't be covered in this overview video. The autonomic nervous system maintains a state of homeostasis and is divided into two main divisions. In the autonomic nervous system, there are two classifications of general visceral efferent neurons: preganglionic and postganglionic. These descriptive terms are unique to the ANS. The sympathetic division helps to ready the body to encounter stressful situations. It is known as the fight or flight response. Preganglionic sympathetic neurons have their cell body in the lateral horn of the spinal cord, at the spinal cord segments T1 through L2. They have short axon projections that travel to paravertebral or prevertebral ganglia. Preganglionic sympathetic neurons are cholinergic, meaning that they release acetylcholine as a neurotransmitter. Postganglionic sympathetic neuron cell bodies are located in the ganglia and have long axon projections that reach a wider range of target tissues in more of a shotgun approach. Postganglionic sympathetic neurons are mostly adrenergic, which means they release norepinephrine as a neurotransmitter. There are some exceptions to this, most notably in sweat glands and the adrenal medulla. The parasympathetic division counteracts the sympathetic division by calming the body down and directs focus towards resting and digesting. This division also consists of a two-neuron classification. Preganglionic parasympathetic neurons arise from named cranial nerve nuclei in the brainstem or from the sacral spinal cord. Their axon projections are long as they course toward the postganglionic neurons. Postganglionic parasympathetic neuron cell bodies will typically live either within the wall of target organs or close nearby in a nervous plexus. These neurons don't have far to travel and are relatively short. This gives them tighter control over their targets. Both preganglionic and postganglionic parasympathetic neurons are cholinergic, releasing acetylcholine as a neurotransmitter. General visceral afferent fibers in these two systems help to monitor and regulate their opposing actions. Our spinal cord segment will be drawn as normal until we reach the spinal nerve and rami. When exploring sympathetic nerve pathways, we will include these additional structures. There will be two ventral projections off of the spinal nerve or adjacent ventral rami. The medial branch is called the gray rami communicans. The lateral branch is called the white rami communicans. White rami are highly myelinated, giving them their white appearance, and are only present at spinal levels T1 through L2, similarly to the occurrence of the lateral horn. Both the white rami and lateral horn are two structures specific to preganglionic sympathetic neurons. These two rami connect the spinal nerve to the sympathetic chain ganglia. This has other names as well, such as sympathetic trunk and paravertebral ganglia. They all refer to the same structure. The reason it is called a chain or trunk is because there are more than one. The sympathetic chain ganglia extend superiorly and inferiorly, even above T1 and below L2, to distribute sympathetic fibers throughout the entire body. Gray rami communicans are present at every level of the sympathetic chain. All innervation that is heading for the body wall must pass through this rami. We will also draw some sample target tissues to get a feel for the effect that the sympathetic division has on the body. I'll draw some eyes and lacrimal glands, some salivary glands around the oral cavity, the heart, and the visceral structures of the body wall, like erector pili muscles, vasculature, and sweat glands. We will start our sympathetic nerve pathway by highlighting the lateral horn. GVE preganglionic sympathetic cell bodies begin here and leave the spinal cord through the ventral root. Remember that the ventral root contains only motor information. These axons will continue through the spinal nerve and ventral rami until they reach the white rami communicans, which takes the nerve into the sympathetic chain ganglia. Here the nerve has four basic options. First, the nerve can synapse onto postganglionic sympathetic neurons at that spinal level. After synapsing, postganglionic neurons can then head toward the body wall. To get there, it needs to pass through the gray rami communicans. Postganglionic neurons acting at the skin cause contraction of the erector pili muscles to give you goosebumps, stimulate vasoconstriction, and increase production and excretion in sweat glands. Remember that neurotransmitter exception I mentioned earlier? Postganglionic sympathetic neurons that act on apocrine sweat glands in the skin are actually cholinergic. They release acetylcholine as a neurotransmitter. A second possible course is that the nerve can descend one or multiple levels to synapse on a lower ganglion. Likewise, the nerve can decide to ascend one or multiple levels to synapse on a postganglionic sympathetic neuron higher up in the chain. Postganglionic neurons that synapse highest in the chain at the superior cervical ganglion can travel to the heart and even to the head via the carotid plexus. In the head, sympathetic stimulation will cause pupil dilation, or mydriasis, and decreased secretions causing dry eyes and mouth. Sympathetic innervation to the heart will increase contractility and heart rate. And lastly, the nerve can leave the chain ganglia ventrally without synapsing in the sympathetic chain to travel towards a prevertebral ganglion. Here, I will draw an abdominal aorta with three major ventral branches, which is where some of these prevertebral ganglia live. These nerves are called splanchnic nerves and generally innervate the abdominal or pelvic organs. Splanchnic nerves arise from specific segments and travel towards predictable targets depending on the level. I will also draw some abdominal viscera, like the stomach and large intestine. These two organs can represent innervation to the foregut, midgut, and hindgut. Sympathetic innervation to the abdominal organs will decrease motility and slow down digestion. There are many different effects of the sympathetic division of the ANS, and these are only a small sampling, but it serves our purpose of introducing the main GVE systems. Now we will move on to drawing the other division of the autonomic nervous system. When we want to draw out the parasympathetic division of the ANS, we need to start by drawing the brainstem. Start by drawing a short, wide V at the top. Then draw a short line down the page. On the left side of this line, draw a C shape. Repeat this line mirrored on the other side. This is the middle portion of the brainstem. Next, draw a line that begins to the left of that central line and then slips downward at the midline. Repeat mirrored on the other side. Extend a curvy line from the inferior aspect of the C on each side. Then extend a short line on either side of the superior aspect of the C, lateral to the V. The most superior portion of this drawing is the midbrain. The bulging middle portion is called the pons. The most inferior portion is called the medulla oblongata. The two bumps in the middle look like the medullary pyramids. These three structures make up the brainstem. We will also draw some effector tissues similar to our sympathetic division: eyes and lacrimal glands, salivary glands of the oral cavity, the larger parotid gland, and the heart. The cranial nerves that contain GVE parasympathetic fibers are cranial nerve 3, cranial nerve 7, cranial nerve 9, and cranial nerve 10. These are good cranial nerves to remember. Cranial nerve 3, the oculomotor nerve, exits the brainstem in the midbrain. Preganglionic parasympathetic neurons traveling with this nerve originate in the Edinger-Westphal nucleus. Cranial nerve 7, the facial nerve, leaves the brainstem from the pons. Preganglionic parasympathetic neurons in this location find their origin in the superior salivatory nucleus. Cranial nerve 9, the glossopharyngeal nerve, exits the brainstem from the medulla oblongata. Preganglionic parasympathetic neurons traveling with this nerve begin in the inferior salivatory nucleus. The last GVE cranial nerve 10, or the vagus nerve, also exits the brainstem from the medulla oblongata. General visceral efferent fibers within the vagus nerve originate in the dorsal motor vagus nuclei. The vagus nerve supplies the majority of parasympathetic fibers to visceral organs. The first three cranial nerves we mentioned synapse onto postganglionic parasympathetic neurons that reside in one of four named ganglia in the head: the ciliary ganglion, the pterygopalatine ganglion, the submandibular ganglion, or the otic ganglion. Preganglionic neurons from the Edinger-Westphal nucleus travel to the ciliary ganglion, where they synapse onto postganglionic parasympathetic neurons. Postganglionic neurons then travel to the ciliary and sphincter pupillae muscles in the eye to produce accommodation and pupil constriction, also called miosis. Preganglionic neurons from the superior salivatory nucleus can synapse on postganglionic parasympathetic neurons in the pterygopalatine ganglion, that then travel to the lacrimal and nasal glands to produce watery secretions. Or they can travel to the submandibular ganglion to synapse on postganglionic parasympathetic neurons that stimulate the oral salivatory glands. Here is where we really see that the parasympathetic keeps you juicy. Preganglionic neurons from the inferior salivatory nucleus will travel to the otic ganglion to synapse onto postganglionic parasympathetic neurons. These then supply the largest salivatory gland, the parotid gland. The vagus nerve, however, does not have an associated ganglion like the other cranial nerves. Instead, the vagus nerve feeds the postganglionic parasympathetic neurons in nerve plexuses on an organ surface or intramural ganglia within the organ wall, providing parasympathetic innervation to the majority of abdominal viscera. Seems like a big job, even for the vagus nerve, but actually it doesn't. Vagus nerve fibers don't quite reach past the splenic flexure of the colon. Instead, parasympathetic innervation in the hindgut and pelvic region is accomplished by pelvic splanchnic nerves, arising from spinal levels S2 through S4. These neurons, like the vagus nerve, have long preganglionic projections that mostly synapse on postganglionic neurons within the organ wall. If it doesn't seem like the parasympathetic neurons travel to the body wall or extremities, that's right, it doesn't. Sympathetic neurons are the only autonomic supply to these tissues. And there we have it. This video should have given you a nice basic overview of the sympathetic and parasympathetic divisions of the autonomic nervous system. Best of luck in your studies. I hope you find confidence to reach your goals, and I hope these videos can help you get there. Thank you for watching and have a great day.